This podcast is intended for educational purposes only. For more information and our full disclosure, please visit ncmidwifery.com and our podcast page. Welcome back to More About Birth. We're here with another episode with Shannon Bennett and Angie Hansen, your hosts. And today they have a special guest in the studio, and it's a new year. So let's go in now and see what they have for us. Hey, ladies.
Hey, hey.
Hi. So, Angie.
Yeah.
You have a special guest with us today. I'm going to let you introduce her and tell us what it's all about.
Yeah, thanks for joining us. We're really excited to have our guest on today. This is Kathryn Holm, and she is both a registered dietitian nutritionist and a certified lactation counselor. So, kind of a dual
So, what are we
interest
talking
there.
about today?
We're going to talk about some breastfeeding issues and pick her brain a little bit about just some of the different issues that we've seen lately. And what she's got for us.
We've been seeing some things lately, let me tell you. So I'm anxious to find out what you have to say about things.
Yeah.
Like flying objects or?
We're going to try to stick to the topic, but you know that we usually don't. So,
I'm just asking the hard questions today.
That was really hard.
Just really random. Okay.
I'm not even sure I get it, but whatever.
Okay. So, Kathryn, tell us just a little bit about your journey and what inspired you to become a lactation counselor.
Hi. Well, I was working as a dietitian at the hospital, and I had been assigned the pediatrics and PICU wards. And I dealt with a number of patients that came in that were breastfeeding. I saw exclusively breastfeeding moms with babies in there who failed to thrive. I'm even tongue-tied today. And I really didn't have the training I needed to know how to help these families. And so the opportunity came to take this class, and I thought it would be a great opportunity. So I did it. And then I also knew I was planning to have my own children at some point, and I thought it would be great knowledge. And it was way more than I anticipated as far as its help in my journey.
Wow. So I didn't realize you did that training before you had your kids. That's right?
I did.
Okay.
Yes.
Okay.
Was this the dietitian training or the breastfeeding support training?
This was as a lactation counselor.
Okay. So
I was already working as
She was
a
already
dietitian.
working as a dietitian.
it probably really helped then with your own children, having taken that class.
Yes, tremendously. It gave me a lot of knowledge. There's nothing like experience, though.
Right.
Yeah.
So unfortunately, I wish I could say that I had all the knowledge and I didn't have any issues myself.
Right.
But the reality is once you actually try it yourself, it's a little harder sometimes than just knowing what the book says.
Yes.
And babies aren't cookie cutters. And so you think, oh yeah, I've got the basics. But then when you go and try it yourself, it's like,
Yeah.
what do I do with this baby that's falling all over the place?
But isn't that true? Isn't that true about everything? Hands-on is the way. I mean, obviously you have to have the book knowledge, but you always have to touch.
Well, right. Like
feel
midwifery, I always tell Angie, whatever you're studying, let's do the hands-on for that portion because without each other, they're kind of worthless.
And I think memory, it's muscle memory too.
memory,
So yeah, it's not just your head, just using your hands to learn how to do things.
And I find that babies have different sized mouths. You have these tiny little girl babies with these little birdie mouths that hardly open, and moms with big breasts, or you have moms with small breasts and babies that have a nice nursing mouth, we call them. And it can all affect the relationship of breastfeeding.
Right.
So you have some questions for us, right?
Yeah, so I think we're going to start out and just talk a little bit about the benefits of breastfeeding, because I think a lot of people know some of them, and I think our, crowd in particular cares about breastfeeding, but just give us some of the details.
All right. Well, I think a lot of people, like you said, have heard that breastfeeding is beneficial, but I think it helps to understand the why at times. There's pros and cons to every decision we make. If you're trying to decide which house to buy, there's this good about this place and there's this good about this other place. And which one is the right one? It's
the
not
price.
It's not always easy decisions, and there's not always one right answer, and there's no one right answer for everyone, even with breastfeeding. So I just want to put a little disclaimer here that there are moms who are wonderful moms who choose formula, and I have no judgment or I don't want to guilt or shame any mom for her decision. It's hard enough to be a mom. It's hard enough to be a woman. We're always comparing ourselves and feeling bad that we're not doing a good enough job. And so I just want to put that out there that I don't have any.
Yeah, we agree.
Any judgment about any reason. I mean, people have different reasons.
Yeah,
there are pros and cons for breastfeeding and pros and cons to formula. So I just want to put that out there.
Amen.
But as far as breastfeeding, if you're like on the fence for those moms that are like out there today and they're like, well, are they the same? And I've actually worked with some physicians who said that formula was better.
Really?
So it's not always as known as we think it may be that breastfeeding is best. So some people are not sure if breastfeeding is better or not. And then there's people that hear about it, but then they're like, well, it hurts. Oh, I guess I don't want to do it. And they're like, is it really almost the same formula? Put all these vitamins. It's so good. And the formula manufacturers have done an excellent job at marketing.
What I find is people like to be able to measure things.
Yeah.
With formula, they say, I know that my baby's getting enough because my baby drank 2.5 ounces or my baby drank 3 ounces. I don't know how much they're getting out of my breasts.
Yeah.
Exactly.
I like knowing that they're getting enough.
Yeah.
True.
Right.
So, yeah, I mean, there definitely are some advantages that way to formula. It's easy to see and they can hand that baby off. And, I don't really want to focus a lot on that because my focus is on helping moms breastfeed. Yeah. But I don't have any judgment. I mean, if a mom does choose a formula feed, that's totally her choice. My focus in my business, because I have a private practice and I do work with lactation, my focus is helping those moms that want to breastfeed, without judging anyone. That doesn't choose that, that's okay.
Right.
But the moms that really want that experience, what I don't want is moms that are at 2 a.m. crying because they don't know what they're doing. They can't get this right.
I get those calls.
Babies, they're in pain. Babies crying. Yep. And they're ready to run to the store and buy formula because they don't know where to turn.
Yeah.
Yep.
And that's where I want to come in and say, hey, there's support. There's help.
Yeah. Yeah.
So if I can put a little personal kind of story in here,
please.
Sort of personal story. Just in my line of work, I'll be out now pre-COVID days when people actually talk to strangers in the grocery store.
Now you got to do it with a mask.
Back in the day.
Back in the day.
Back in the day, yeah. Pre-COVID.
Back in 2019.
Yes.
I run into, moms and the grandmother moms in the grocery store and, they see me buying produce or something and they'll say, oh, what do you do for work? And they'll start chatting with me. And then when I tell them I work with lactation, over and over again, I've heard from one woman after another, sometimes even tear up.
Aww.
And they'll say, oh, that is so wonderful you do that. I wish I had that support when I was breastfeeding.
Yeah.
And it's just amazing to me that women are grieving, some of these women are grieving the rest of their lives for decades that they didn't get to breastfeed or even didn't get to breastfeed as long as they wanted.
Well, is it our culture, there wasn't a lot of training, was there? I mean, when we were having our first kid,
there was not much support. So 37 years ago.
Woo!
Yeah.
Don't go
so
there.
Yeah, so the fact that we're just having this podcast and we're talking about it, and it's important for people to at least get an education and realize that there's support available.
So I don't even know. Do they still even have Lactation League meetings? I mean, not during COVID, but.
I think their online community is still active.
They were pretty popular, like in-home meetings 37 years ago.
While back, but
and that was where you would go. And that's where you would go to get that kind of help.
Right.
Yeah, I remember that.
And probably centuries ago, it was moms and grandmothers and aunts all in villages together and helping them. And nowadays, people are kind of all on their own. Their family might not be in the state, and they have this baby, and they don't know how to feed him. And we would think that, I guess, even though I went through this training, I thought when I had a baby, it would just be instinctive.
Yeah.
I know. It's funny. We can laugh because it's.
But isn't that what people think? Yeah. You think it's just going to be natural.
Put that baby on and they'll know what they're doing. And it just doesn't always work like that.
You've never nursed before. They've never nursed before.
Yeah.
So there's a little bit of a learning curve.
And some babies will be great. And some babies, there's a lot of more learning than others. And that's where I just want to support moms. And if there's moms that are dealing with if they do have hassles, some problems, issues down the road, maybe some pain or baby's sleepy and falls asleep as soon as he latches or she latches, then they don't know if they have some of the ideas of why they want to do this. If they're strong, then that can help them to want to keep going through the challenges.
I love that. Yeah, the commitment and everything. Yeah. So tell us a little bit more about that. If there's anything else you want to say about the differences between formula and breast milk and why breastfeeding.
Yeah.
Why should they be committed?
I mean, the hormones associated with breastfeeding help a new mother to feel motherly.
Yes.
It's if clients are concerned about being a good mother, you can reassure them that breastfeeding can make it easier for them to feel motherly. The same hormones, these hormones kick in that mammals have, and it just there's a bonding thing about a hormone, that hormonal chemical bonding between a mom and a baby is incredible, and it helps them to feel interested and protective of their baby.
Right.
Yeah. So you probably know a lot about the hormonal side as a midwife. But
that's something that you get more with breastfeeding, not just being with your baby, right? Like those hormones kick in more with nursing.
Exactly.
Yeah.
It's that oxytocin
that's
released.
Right. Yeah. That's the next thing I was going to say is physically, breastfeeding is physically pleasurable because it releases that same hormone that is released from orgasm. So it gives that sense of pleasure and a bit of a sense of relaxation.
Yeah.
With that, of just helping a mom to feel,
relaxed.
Yes. And bonded.
So does that help with postpartum too then? Depression?
Yeah.
Because we've not, does it? Yeah.
Yes.
Yeah, I think it does.
It's a hormone imbalance.
Okay.
So,
yeah,
it helps the mother just to feel good. It's fulfilling. And, you all have to see, like, just because of the oxytocin release, that as the feed goes on, the mom and baby fall asleep together.
Yay.
It's a really sweet experience.
Yeah.
It's a very fulfilling experience that women have that they appreciate and are proud of the rest of their lives.
Yes. I love it.
There's something about knowing that your body is causing all those fat rolls on your baby.
Yeah.
It's really satisfying.
It is.
Yeah.
It's true.
It was your milk that made that baby grow and nothing else. It's amazing.
True.
It also makes the mother to feel that she has a unique and irreplaceable importance. And who doesn't want to feel that they're unique and irreplaceable?
My friend just told me the other day that I got a puppy, my 19-year-old, that I got a puppy because I just needed somebody to need me still.
I need you still.
Like, well, maybe.
Well, and the other thing to think about, too, is babies love to nurse.
Oh, yeah.
If you give that baby a choice, they almost always want the mom.
It's just something I'm having a hard time convincing new moms of lately, that babies don't always nurse because they're hungry. They nurse because they want snuggles, because they want to suck, because they just need to be near you.
Yeah.
The comfort and touch, vitamin T.
And they don't seem to be okay with that need, that constant baby needing them. They're used to having their hands free and being able to do the things they need or want to do.
That's why when new moms have babies, we give them that third arm so that that helps, right?
Third arm? Are you setting me up?
We could do that. We can start handing out third arms. You're always saying you need an extra.
There's no third arm. There's the husband to help them.
Shannon looked at me like,
there you go. And I'm so glad you brought that up, because sometimes it's the dads that don't want the mom to breastfeed because they feel like those breasts are mine. And they don't want them to
Or
share.
it's just the fact that all of a sudden the baby's getting all the attention and you don't know. It's like you don't know how to find your place in that situation.
And dads don't know how to bond.
Help. He's
I felt helpless because I can't breastfeed the baby, and I know that this bonding thing's happening. And so you go, okay, when is your turn? Now I realize it's when they get a little older, they follow you everywhere as the dad. But when they're first born, it's this whole bonding thing. It's fascinating when you look back at it now, but it can be intimidating for those guys that may be listening to the podcast. But it's super important for the mom and that baby for that to be happening, and it does happen.
Yeah, I feel like we need more education for dads about it's normal for them to be a unit. It's normal for you not to be able to do much.
Yeah. Well, and I think that if, babies feel the most secure when they're with mom and when they're getting that attention. And so the idea is that the more attached baby is to mom, the more secure they're going to be going with other people later in life. So having that relationship with dad when dad takes over and starts doing the adventures and the dad things, I think that that bond early on is only going to strengthen those other relationships, don't you think?
For sure. Well, and let's just, there are studies too about dads So moms, the benefits of skin to skin are great, but there's also benefit for dad.
Yeah.
Babies know who dad is. It's amazing how I don't know how they know, but somehow they know. They
so
heard
precious.
in utero or
Their
something.
voice.
Well, yeah, and
dads
I
can
never really
definitely
thought
help
when I
with-
had my first child, Christopher, that he was listening to my voice and all the stuff now that we think about, you know, to already getting familiar with who I am. Because my voice is definitely unique.
Yeah.
And so they
Yeah,
hear
it
it
is.
even, even Zoe, our new little puppy, understands, you know, my voice, which is incredible to know now looking back. I wish I knew more then.
Yeah, we were so ignorant. It's okay. They survived.
Yeah,
But
that's
dads can
a
definitely
great point.
still be involved. They can help bathe the baby. They can dress the baby. They can take the baby while mom's trying to get ready to do something else.
Yeah. Diapers.
And there's plenty of time for dads to be involved. And you encourage dads to be
Yep.
involved because,
Right.
you know, but like Angie was saying, that bond, I mean, the mother-child bond, that's the strongest bond on earth. And it is something very important to get that bond so they can have that security later.
Yeah.
Yeah, I love that.
And of course, there's also we already talked about the irreplaceable thing, and that kind of is nice for even some of these teenage moms that, you know, may hand that baby off to grandma and let her take over. But for those moms that are teenage moms living with their mother, this way there's no fear that grandma's going to take over that baby. It's their baby. And the only person on earth that can, you know, that baby needs them.
Yeah.
And there's something really sweet about that.
Yeah, that's precious.
So besides that, dads may also like that it helps moms to get their figure back sooner,
Yeah,
lose some of that
weight
weight.
loss.
And it helps the uterus to contract with every nursing.
Right.
And maybe you could tell us a little bit about that and what that.
Yeah, so that nursing releases the oxytocin. The oxytocin is what causes the uterus to contract. And right after your baby's born, so that placenta has been there attached to the inside of the uterus forever. It comes off, it's given birth to, and you still have this wound in here, and your body is still pumping blood to that wound. So in order to shut down those vessels, the fibers in your uterus have to shrink down and clamp down to shut off those vessels. So when you put your baby to the breast right after birth, it releases the oxytocin and it clamps down. It keeps you from bleeding too much, keeps your uterus firm, and it helps the involution process because your uterus is the size of a watermelon when you give birth. And by the time I leave 3-4 hours after the birth, that uterus is only about the size of a grapefruit or a big orange. So in order to keep it tight and shut off those vessels, you have to have that contracting. And it also just helps keep it toned and get it back down to its regular size and shape with all the nursing afterwards.
So what about moms that don't have that breastfeeding experience? What does that? How does that affect
If
them?
you give birth in the hospital, 9 times out of 10, you're going to have Pitocin in your IV drip afterwards that causes, it's the synthetic oxytocin that will cause that cramping and clamping down of the uterus. And by the time you're done with that, it should be good to go.
Okay.
So,
But for those moms who are breastfeeding, they may have less postpartum bleeding and return to their norm a little bit faster.
So does it continue on then as they're breastfeeding? It doesn't just stop like after.
the
So they leave.
contracting,
Yeah, they leave the
it
hospital.
slowly becomes less and less.
Okay.
And less noticeable. But even if you're not breastfeeding and you're just holding your baby skin to skin and bottle feeding, sometimes just hearing your baby cry or missing your baby, putting your baby on your skin will cause your body to release oxytocin also. It's pretty amazing. God thought of
Skin to
everything.
skin is really amazing. There's so
Yeah.
many benefits to skin to skin and keeping babies warm and all that.
Yeah. Yeah.
So, and of course, then there's all the health benefits too.
Yeah.
Mothers of breastfed babies make fewer trips to the doctor's office, and you know their babies are almost never sick enough to be hospitalized. Our bodies are so amazing that the milk actually changes even during the feed to meet exactly what baby needs.
Yeah.
Baby puts a little saliva in there, and mom sends out the right antibodies, and
crazy.
babies just stay
Yeah,
well. And
that's incredible. And I think I was talking with a friend about that yesterday because that whole saliva interchange, I just don't think people even know or think about that enough. But especially heading into cold and flu season and with this time of, everyone's stressed about COVID, like that is an incredible feature to be able to have, that your body is communicating with your baby to produce exactly what that baby needs.
That's right.
To keep them healthy, like viruses and bacteria and all this. It's incredible.
Awesome.
And there's no formula that can do that. Nothing similar.
Right.
And no formula also has the components that breast milk does in other areas, such as cholesterol. And we usually hear that word and think negative thoughts. But actually cholesterol is needed to form the lining of every cell in our body. And breast milk has cholesterol, which no formula has.
Wow, interesting.
And so babies, as they're growing, they need to make new cells. So they need that cholesterol to form new cells and to form their brain. They get the essential fatty acids through the breast milk as well to help their brains, which is why babies that are breastfed tend to have higher IQ.
Wow.
And less learning challenges in school. And of course, the antibodies, 2 to 5 times more ear infections in babies who are formula fed.
Can you address the fact that a breastfed baby lying down feeding your baby will not cause ear infections like a baby lying down with a bottle? Do you get that question much?
I'm not sure I've had that question before.
Okay. Because moms are always wanting to know why. Why can I lie down and feed my baby in bed and you're not worried about a breast infection or a breast infection? An ear infection. Boy, I got breast on the brain.
Well, the thing about it though is, there's several aspects. I don't know that I have an exact answer to that question.
I haven't heard that about the lying down thing.
Yeah, I'm not sure about that position and all that. But what I could say is that even one bottle of formula changes the bacteria in the gut. And if that bottle is in the first 24 hours of birth or really early on after birth, it may never go back to being exactly like a breastfed baby's.
Really? The
flora.
gut may not go back?
It may not if it's in the very beginning. If it's a little later on, and if it's 2 to 4 weeks of exclusive breastfeeding, it can return to being pretty similar to
So you had
the
a question
breastfed.
about that, introducing the bottle. I don't know if we've covered all the benefits yet. But
Yeah,
we
can
jump
we
around.
can segue into that. So yeah, we wanted to talk a little bit about what are the issues that come up when you introduce a bottle or a pacifier early on, because we're seeing a lot of this lately. I think part of it is the accessibility of breast pumps has increased a lot. Moms are more mobile. They want to have a, store of milk in their fridge and freezer.
They want to go out with the girls.
They want to go out. They want to be able to leave baby, or some of them have to for work or so forth. But we're seeing a lot of early on issues and people using bottles and pacifiers. So what are some of the things you know and see with that early introduction?
Yeah, and that's basically what I was just touching on, is that how it changes the flora of the gut, introduces different types of bacteria. The bowel of a baby, it'll become like an adult's in just with a very relatively small amount of formula. Even it doesn't take much.
Are you talking about leaky gut?
Just the bacteria composition. I don't have the names
So like
in front of me.
the probiotic aspect,
Because the immune system resides 90-some% in the gut.
I can pull,
Yeah,
pull up. Some
it
of
all
that.
starts in the gut. Yeah.
So, if I can read my notes,
Go for it.
Please.
You have your small PowerPoint. I know exactly what that is. The small
a
thumbnail.
magnifying glass.
just about.
I would.
But yeah, even one bottle can be harmful to the mother and baby. Well, there's several things it can do. For one, there's the physiological aspects, but there's also the likelihood of increasing serious allergies. It increases the chance of bowel infection, causes nipple confusion and latch issues, often leading to early weaning. It affects the delicate supply and demand balance, because at one bottle, then a baby's formula is hard to digest compared to breast milk. Breast milk is very easy to digest.
So
they're not as hungry.
The baby sleeps longer if they have.
That's right. They're not hungry as soon. So then mom's supply gets diminished because baby's not nursing enough to keep mom's supply going, because it's about a supply and demand issue, which is another one of your questions about milk supply. And so that's part of that.
It's a vicious cycle.
Plus, there's antibodies being transferred back and forth, right? With breast milk compared to bottle feeding.
Yeah, that's what we
So
were saying.
anyway, I got a little side. So the gut, basically, breastfed babies have a lower gut pH. It's an acidic environment, approximately 5.1 to 5.4. Throughout the
Didn't know
first
that.
6
I didn't
weeks,
either.
it's dominated by bifidobacteria with reduced pathogenic microbes like E. coli, bacteroids, Clostridium, Streptococcus. Doesn't have as much of those. Babies fed formula have a high gut pH of approximately 5.9 to 7.3, with a variety of putrefacted bacterial species.
Wow.
So when formula supplements are given in the first 7 days of life, actually, I think I said 24 hours, so it's even the first 7 days of life, this production of a strongly acidic environment is delayed, and its full potential may never be reached.
Wow.
Breastfed infants who receive supplements develop gut flora and behavior like formula-fed infants.
That would explain why this current generation has so many allergies and gut issues.
Oh, yeah.
So much leaky gut.
I think so.
And digestive problems.
Kind of makes breastfeeding legit.
Maybe we should all have breast milk.
Let's all, yeah. Yeah. And so what about, as far as that's kind of like the nutritional side of it, and what about the physiological, like causing nipple confusion when you're introducing these other, false nipples earlier on? Yeah. What do you see with that?
So, bottle introduction, I mean, they used to say that 6 weeks, wait 6 weeks before you introduce a bottle, but it really varies. And babies can learn to drink a bottle at 1 month or 2 months, or even between 3 and 6 months. It doesn't have to be something that they learn from birth. In fact, sometimes babies starting on a bottle earlier on will forget and not even know how to do it later on when the mom does want to go to work. So there's not really any advantage that way. If a mom does want to go back to work, there is a sequence we recommend, starting a little bit ahead so she doesn't get to work and then the baby refuses to take a bottle the whole day she's gone.
Yeah.
So there is a time period there to kind of look at to introduce
Can you talk
the bottle.
about that? So we have a lot of moms that are having to go back to work, and it's really great with all the new programs we have with extended family leave and paid time off that they're getting to stay home longer. But what would you tell them if they have to go back to work and they want to continue pumping so that their baby can still have breast milk? How do you do that? When do you introduce the bottle, and when should you pump? Should you
Good
pump
question.
first thing in the morning?
And, I think this is going to vary a little bit individually based on how soon that mom does have to go back to work. So if a mom has to go back to work right away.
Let's say 12 weeks, mom has to go back to work. What
So
would you tell them?
Ideally, we'd want to see that mom have 3 to 4 weeks of good breastfeeding before she tries.
Breastfeeding? No bottle.
Before she introduces a bottle.
Okay.
Yeah.
So have the latch really well, going well and be a good latch and all that. So if she's having trouble with getting the latch going, that's not the best time to introduce a bottle because then there's the risk of nipple confusion. Because the way a baby drinks at the breast is different than the way baby drinks on a bottle.
I always tell people it's kind of like the difference between drinking out of a straw and having to work for your dinner.
Right, yeah.
So we just want to recommend it that gets really well established. The baby's good at what he or she is doing
So
at the
how
breast.
would you introduce it? Would you introduce the bottle like when baby's not very hungry? Would you introduce it when baby's ravenous? First thing in the morning, maybe later in the day? I mean, is there a good time to do that where your chance of success is better?
I don't know that it's about the time of day so much as who is giving the bottle.
Oh, tell us about that.
If the mom tries to feed the baby a bottle, it's likely the baby will refuse because they know where it's good. And they'll want mom. But ideally, if you can get someone else, either the caregiver, ideally even the caregiver that's going to be with the baby while she's at work, let them do it. Sometimes if the baby knows mom's there, they'll refuse. But if mom kind of goes out grocery shopping or something right then, leaves the baby with the caregiver for just even an hour or two just to try it, give that baby a chance to try the bottle with someone else.
Okay.
It could be other.
Yeah, but you had some notes, right, as far as like the timing of like the months, like so 3 to 4 weeks. I wanted to hear those percentages again about how likely a baby was to take, because
yeah, this is interesting.
you would think it would decline progressively. Like if you introduced a bottle, early on it had high success and then it would go down from there, but that's actually not what you said. So let's hear those percentages.
Yeah, so this was according to one study anyway. It found that the vast majority of babies accepted a bottle easily. Whether it was introduced at 1 month, 70% accepted it then. At 2 months, 63% accepted it. But between 3 and 6 months, 72%.
Okay.
Yeah, it went back up.
So it went up. So, don't be in a rush, guys. Like, it's still possible to work this all out. And it doesn't have to be within the first week of life.
And I think I said this earlier, but sometimes when they're given a bottle earlier, they actually forget and they don't necessarily take a bottle later.
So you almost have to have like some kind of a PhD or something anymore to figure out what bottle to give your baby. Do you have...
That's because there's so many different options now.
Yeah, if you have to do the bottle, you're going back to work. Do you have a favorite nipple or?
I don't really recommend specific brands or, all that, but.
I mean, there's the long nipples, there's the flat-ended nipples, the flat nipples, like.
Yeah, I don't know.
I think it's a personal preference. I'm not really, in my school practice, I cannot recommend like a pump brand. I don't know about bottles, but I kind of steer away from recommending specific brands. But what I will say is I do recommend keep the flow low, because what we don't want to see, and this is sometimes what happens, is that babies get used to taking a bottle and it's fast and easy.
Yes.
That then they prefer that to the breast, because the breast takes a little longer. And then sometimes they'll start having breast refusal. And for a mom that wants to breastfeed long term, that can be devastating.
Yes.
Because baby saliva stimulates milk production.
Yeah.
And if she doesn't have baby at the breast, it makes it hard to have that longer
So
term.
if they're downing 2 ounces in a couple minutes, it's not good.
So, just even downsize at preemie or newborn, they have the different stages, just go low.
I've had people
that's a
use
good point.
preemie nipples for their newborns when they do have to start introducing the bottle because everything else is so fast.
The challenge that I do see is when moms send their babies to daycare, and the daycares aren't willing to sit there and feed the babies a long time sometimes.
Yeah.
Oh, wow.
So that there are challenges. And again, some of these things are just case by case basis of having, how to work with each situation. I mean, if you're at home and you have a private caregiver and, grandma or someone, they might even be willing to do a cut feeding, which is recommended over bottles.
Yeah.
Wow.
Do you ever recommend finger feeding or like?
I recommend spoon feeding.
Yeah.
Yeah, like a little baby spoon. It's amazing. It doesn't really take any longer than a bottle feeding.
Yeah. Yeah. So I get questions a lot about, well, when should I pump? And I have to store milk to feed this baby when I go back to work. What do you tell people about the best time to pump?
Well, I recommend pumping just kind of on their schedule that they're normally breastfeeding at least every 3 hours, like if they're at work. But also think about the time that they're gone from the baby, not just the time that they're actually at work, but the time it takes to get to and from work, when the last feed was before they left home, between when they're going to be able to feed the baby again.
What about getting ready and storing milk
ahead
to get a little bit ahead?
Right.
So
a mom can start off by pumping at the end of feeds and trying to stimulate a little extra production that way, and pump until she sees the last drop of milk. If she really wants to get a little more, she can go an extra 2 minutes beyond that. Try to increase her supply and start storing up a little bit gradually.
Which brings up something. The Haka, it's become really popular. Do you want to talk about this? You said that you recommend it, correct?
I don't know that I recommend a lot of devices, because I think that it undermines mom's confidence that they can do this. Because our bodies are made to breastfeed, and we don't really usually need devices. We can do this on our own.
No,
there are times where this can be helpful.
I've never used this like as a breast pump, but moms that are having issues and they got to go back to work and they are worried they're not going to have a big enough supply. Sometimes I'll have them just wear the Haka on one side while they nurse on the other, and they're not doing anything. It's not taking any more time.
No, I think it's a great idea. I have recommended that as well. Instead of leaking and losing that milk, it'll catch everything they're leaking out.
It's like liquid gold.
Yeah, don't throw that away.
Yeah.
Yeah. Of course, they can also put a little pressure on that side and
to keep it from
leaking.
Right?
But maybe not early on.
Okay. Well, I want to shift gears really quick and, move away from the working mom to the mom that is stay at home and really wants to give breastfeeding a go, but is having issues. Because we've seen this a lot, and I mean, we could go on and on forever. We're not going to be able to touch on all the specifics right now, but what I wanted to talk about was something that it was an analogy I've been thinking about.
It was a good analogy.
I had a brainwave.
Yeah.
Because, if you have to go back to work, that's a separate issue. I wish that all moms could stay with their babies and just kick back and nurse all day long. Some people can't. But for our mamas that can and that want to, I want to talk about being 100% committed to breastfeeding versus 80 or 90 or even 95% committed, because I think there is a difference. So let me try my analogy out on you, and then we can talk about it a little bit. But here's the thing. I believe and I think that the most beautiful, lovely benefits of nursing kick in when you're 100% committed. You have the skin-to-skin thing going, the attachment parent thing going, you're nursing exclusively on demand. I think you end up getting more sleep. I think babies healthier. I think moms healthier and happier. That's been my experience, not only as a mom, but as a care provider as well. So here's my little analogy. I think it's like hiking a mountain, okay? And it's really uphill and it's hard going, it's hard work. Now let's say that there is tree cover to the very tip top of this mountain. So you're doing all this work, you can't see anything. There's no beautiful view. You can't see the sparkling sky or anything like that. It's just really hard work. And you get to 95% or whatever, 99%. You're almost to the top of this mountain, and you've worked as hard as you can, and you're just at the end of your rope and you want to give up. And we're seeing this, and some people do give up. And they say, breastfeeding didn't work for me. I had these issues. I had tongue tie. I had latch problems, what have you. It was too hard. I was going crazy. And they're saying, I tried breastfeeding and it didn't work. And I want to say lovingly to some people, not everybody, but to some people, I don't think you did try it 100%. I think if you would have gone 100%, you would have got to the mountain peak and you would have been able to see
above the trees.
I can see this is a beautiful view. It was worth every moment of work. It got so much easier. There's this nice flat spot at the top. I can kick back and just enjoy the view. Yep. And I think you may not get to that place until you're 100, maybe even 105% committed. Does that make sense? Yeah. Do you guys have any thoughts about that?
Well, Ginger used to always tell people it's always darkest before the dawn. And there's always that point where you're just at the end of it. And if you can just push on a little farther and get some help.
Right. And the beginning can be a challenge. And it gets there's sleepless nights at the beginning, but the payoff is definitely there later on. If you can get through the first 3 months, sometimes they will end up getting way more sleep breastfeeding than they ever would on formula. Less screaming babies in the middle of the night going to ER because of ear infections or all sorts of other challenges, getting out mixing a bottle. Down the road, it has its payoffs.
But
it is some investment
almost.
Initially. But that's where I come in too. I mean, if anyone is having trouble, I just want to be there to support moms.
Tell us what type of help you can give them. Do you meet with them in person? Are you doing televisits?
I'm doing all of the above.
I go to
before COVID at least, could go into the hospital and meet with babies there at the time of delivery, help them get started. I go to homes even if it's 2 a.m. I'll do phone consults, video consults in person at their home or my home, whichever they prefer. Some people have a zoo in their house and want to come to my office, and other people prefer me to come to them because they can't even get out the door.
Right.
Yeah, that's wonderful. I just want so much for people to have that beautiful experience that comes when nursing gets to that point where it's easy and you can't imagine doing it any other way because it's so easy. Yeah.
It is that 12-week mark. Life settles down into a routine again. And by then, most babies have kind of gotten themselves on their own little schedule, and it's predictable when they're going to eat, when they're going to sleep, and they're big enough then that you just get them near the breast and they find it. You don't even have to, hide under a tent and get all sweaty.
Yeah. So I really
ninja.
The fourth trimester.
Yes. Yeah. So I just really want to encourage moms to stick with it. If you're having issues, get the help. And don't stop until you get the help. Yeah. Even if it takes going through multiple people and multiple avenues, I believe that, a vast majority of the time, the help is there once you connect with the right
Based on the
person.
analogy, the view's worth it.
The view is more than worth it.
Yeah.
More than worth it. And we've heard stories of people that have worked through unbelievable feats and overcome amazing things. And they're so glad that they didn't give up because it was just beautiful on the other side. So,
and ask for help. You can contact us at the website nc-midwifery.com, and we will connect you with lactation support if we're not able to help you. I know since COVID, the lactation support isn't quite what it used to be through the hospital. So don't let that stop you. Contact us and let us connect you with someone who can help.
So how do they get hold of you? Do you have a website?
I also have a website, and they can directly book with me as well. It's www.holmmadenutrition.com.
There you go. It's on the screen.
HOLM.
So
It is. Okay. There we go.
woo!
All right.
Alrighty, well, thank you so much, Kathryn. This was informative and really fun to have
We
you.
need to have her come back and talk about some more breastfeeding stuff.
I know,
I feel
there's
like we
so
just scratched
much.
the surface. Well,
We
thanks for having
did.
us
We didn't
today.
even get to talk about nutrition for mom and supply issues. So we'll have to do
we
part
can
2.
make that a whole nother
so more to
podcast.
come then.
Yes.
Yep.
Thanks, guys.
See you later.
Thank you.
Well, thanks for tuning in to More About Birth today. Thank you, Kathryn Holm, for coming and sharing your heart with us. On behalf of myself, Shannon Bennett, and Angie Hansen, we want to wish you a very happy new year. And stay tuned 2021 for more about birth. This podcast is intended for educational purposes only. For more information and our full disclosure, please visit ncmidwifery.com and our podcast page.